Good morning, all. Welcome to Nurses Care YouTube channel. Today, we will be discussing regarding some of the previous questions from Assistant Professor in Nursing Examination. In this session, we will be discussing 5 questions and their options in detail. So, we can move on to the first question. Floxylation is characteristically seen in which of the conditions? So, the options are dementia, dissociation, depression, and delirium. So, before identify the correct option, we should know what is the meaning of floxylation and the options in detail. Floxylation means it is an aimless grasping and plucking of the clothes or bedding typically associated with delirium. So, if the patient is having delirium like characteristics or delirium disorder, patient will be trying to move or plucking their clothes or bedding involuntarily. So there is no specific purpose. Patient may be trying to grasp and plucking the clothes. So that is a typical characteristic feature which can be seen in case of delirium patients. So the options are dementia, dissociation, depression, and delirium. We know that the correct option is delirium. So we should know which are the other conditions or what are the characteristic features of other discussed conditions here. So first option was dementia. We know that it is a group of conditions characterized by impairment of at least two brain functions, especially memory and judgment. If the patient is suffering from dementia, they are not able to judge properly, or they will be having some impairment in the cognitive functions, especially memory loss. Then next option was dissociation. We know that dissociation, which is a disconnection and lack of continuity between thoughts, memories, surroundings, actions, and identity. Patient will be struggling for getting a continuity while they are speaking with someone. So they will be having a lack of continuity. They are not able to maintain the communication properly with any persons due to this disconnection between the thoughts and memories. Then next option was depression. We know that depression is a kind of mood disorder that causes a persistent feeling of sadness and loss of interest. The patient is not improving or the patient is not coming out from a depressive episode. Some patients will be trying to kill themselves. Okay, so depression is a mood disorder which is mainly affecting many of the patients, and we can manage these depressive episodes to an extent using some kind of medicines. So delirium, we know that floxylation is a characteristic features which can be seen in case of delirium. So we should know what is the meaning of delirium. It is a serious disturbance in mental abilities that results in confused thinking and reduced awareness of the surroundings. Patient is not at all aware about what is happening around them, and patient is always in a confused mental status. So patient will be having some features like inattention because they are not aware about the surroundings. They are not able to attend in activities that they are doing. Disorganized thinking, memory impairment. There some kind of patients will be having some memory impairment also. Disorientation. They are not oriented to the proper place or persons. Altered level of consciousness, acute onset. It is sudden in onset. Some patients in case of alcohol withdrawal, they will be having similar features of delirium disorder. Then perceptual disturbances and psychomotor agitations are retardation, and they will be affecting some kind of sleep pattern also. So these are the explanations of the options, and our correct option was delirium. So again, I will repeat floxylation, which is very common in case of delirium patients. So option D is the correct answer. Next question, which of the following drug is used to treat enuresis? So before going to know the drug in detail, we should know what is the meaning of enuresis. Enuresis means it is an act of involuntary urination. There is different types of enuresis are there. One type is nocturnal enuresis, which means patient if the patient is suffering from enuresis, that means involuntary urination, especially in case of night time. It is very common in case of small children. If they are after attaining their bowel and bladder pattern, again the patient or again the child is not able to urinate voluntarily, some kind of leakage can be seen in case of night. And also enuresis can be seen in daytime also. While playing with other kids, they will be having some involuntary passage of urination. So we can manage with some kind of symptomatic relief by using certain medications. So first line of management for enuresis include imipramine. Actually, imipramine is a tricyclic antidepressant which has been used since the year 1950s. The primary mechanism of this medicine was to inhibit the reuptake of serotonin and norepinephrine. We know that initial time it was used for managing depression. We know that when the serotonin level is decreasing, it can aggravate the symptoms of depression. So it is mainly to inhibit the reuptake of serotonin. That's why we can maintain the normal level of serotonin in the brain. So that is the main purpose of using this medication. Whereas we will use this type of medications to control enuresis, the main function is which will help to relax the bladder muscles, so that which causing the smooth muscles at the bladder neck to contract, therefore increasing the ability to hold urine in the bladder. So that if you are using imipramine for the kids, those who are affecting from or suffering from enuresis, they will be able to relax the muscles, bladder muscles, and also they will be able to increase the holding ability of the bladder. So to some extent, we can manage enuresis. And the other options was methylphenidate, olanzapine, and risperidone. So we can see which are the functions or actions of these medications. Methylphenidate is used as a part of treatment program to control the symptoms of ADHD, that is attention deficit and hyperactivity disorder, that is very common in case of children. So this is mainly typically used for controlling the symptoms associated with ADHD. Olanzapine we can manage to treat with schizophrenia. Then risperidone also, it is a type of mood stabilizer which can be used for treating with schizophrenic patients. Okay, so these are the options. So our question was, which of the following drugs was used to treat enuresis? Correct option was imipramine. So methylphenidate was used for controlling ADHD. Olanzapine, it is mainly for managing the schizophrenia. Then risperidone, it is mainly controlling the bipolar affective disorder, and it is a type of mood stabilizer. Then third question is, unused BCG should be discarded how many hours after reconstitution? Here we have some kind of durations: 2 hours, 6 hours, 4 hours, or at the end of day. We all know that what is the full form of BCG, that is a Bacillus calmette-guerin, that is a vaccine which is mainly used for managing tuberculosis. So actually this is available in a freeze dried powder and sealed under a vacuum in glass ampule, that is available in a glass ampule form. So this powder we have to dilute with normal saline before injecting into the patient's body. Then, while the unused portions of the other biologicals in EPA, that is expanded program of immunization, may be given until the end of the day, only BCG is discarded 4 hours after the reconstitution. We can mix this medicine or this type of vaccine with diluted with normal saline, and after that, after 4 hours, if we are mixing with the normal saline, we should discard this vaccine after 4 hours, otherwise it won't be effective. Other vaccines, we can use it till the end of the day. Only BCG can be discarded after 4 hours after the reconstitution with normal saline. Otherwise, it will not give any form of effect on the patient's or on the child's body. So the correct option was 4 hours. The next question is, which of the following clients should be classified as a case of multibacillary leprosy? The options are 5 skin lesions, positive slit skin smear, 3 skin lesions, positive slit skin smear, then 5 skin lesions, negative slit skin smear, and last option was 3 skin lesions, negative slit skin smear. In this question, we should know what is the meaning of slit skin smear and what is the meaning of multibacillary leprosy. As we all know that leprosy means it's a chronic infectious disease caused by Mycobacterium leprae, that is a causative organism responsible for the disease leprosy. According to the National Leprosy Eradication Program, there will be 2 types of main classifications. One is paucibacillary leprosy and multibacillary leprosy. Our question is regarding multibacillary leprosy, even though we should know what is the meaning of paucibacillary leprosy. Postbacillary leprosy is a type of leprosy up to 5 skin lesions. That's the main characteristic features of postbacillary leprosy. Up to 5 skin lesions will be there. There is no involvement of any nerves in these conditions, and the skin smear will be negative. That is the typical features associated with postbacillary leprosy. Whereas multibacillary leprosy means 6 or more skin lesions can be seen on patients with multibacillary leprosy. Then there will be some kind of nerve involvement. Then patient will be having a skin smear positive at any site. If you are taking from the lesion from different parts of the body, the skin smear test will be positive. So this is some of the images regarding postbacillary leprosy. You can see some kind of patches over the patient's body. Then this is a picture of a patient with multibacillary leprosy. So this is a picture of a patient with multibacillary leprosy. It is a type of, it is otherwise called as lepromatous disease or Hansen's disease. That is, we know that Hansen's disease is a common term used for denoting leprosy. Multibacillary leprosy, it is a generalized or diffuse involvement of the skin, thickening of the peripheral nerves under microscopic examination. If you are taking the samples from different areas of the patient's body, there will be positive smear test. So the nodular form of this condition is the most advanced form. Ulcerated nodules, that is a typical features of this multibacillary leprosy. So patient will be having the presence of Mycobacterium leprae within this nodules. So if you are taking the slit sample, it will be positive. So this is a typical feature. Plaques will be there, thickened dermis will be there. So this is the pictures of some patients affected with multibacillary leprosy. So we should know what is the meaning of slit skin smear. Slit skin smear means it is a test in which a sample of material is collected from tiny cut in the skin. That's what is called as slit. Slit means cut. Slit in the skin and then stained for Mycobacterium leprae and an acid-facid bacilli. If you are taking the sample from different parts of the body, like from the earlobe or from the tip of the nose or from near the neck region, we can take the sample from different parts of the body. First, we can, while we are collecting this slit skin smear sample, we should pinch the site tight, otherwise we can't get a sample properly. Then we should cut or incise the skin, scrape and collect the material, and it should be spread it on a slide, air dry and fix and stain with ZN method. So this is a procedure for collecting the sample for slit skin smear. Why it is called as a slit skin smear means we will be cutting or we will be making some tiny cuts on the patient's skin. Through that we will be taking the sample. So that is the meaning of slit skin as well as the peculiar features of multibacillary leprosy. So the correct option was 5 skin lesions. So we know that it is a slit skin smear test will be positive. So we can just exclude these two options very clearly. Okay, so multibacillary leprosy patient will be having a positive slit skin smear. So we can just exclude these two options very rapidly. Then there will be two options. One with 5 skin lesions and 3 skin lesions. In multibacillary leprosy, there will be more than 5 lesions. So we can confirm it with first option. So this is the correct option for this question. The last question is the antidote used in paracetamol toxicity. So we should know what is the meaning of antidote and the action of other medicines also. Our options are isoproterenol, desferoxamine, atropine, and N-acetylcysteine, otherwise NAC, N-acetylcysteine. So, what is the meaning of an antidote? Antidote means it's a medical substance that is used to prevent a poison or a disease from having an effect. We know that if a patient is consuming paracetamol for a prolonged period of time or in a high intake of paracetamol medicines, they will be having some problem with their liver. So, if apart from paracetamol, any other medication which is taken in a high dosage that can cause adverse effect in the patient's body. So to counteract with that effect of that particular medicines or substance, we can administer certain group of medicines or medical substances that is considered as an antidote. Regarding the paracetamol toxicity, the toxic level, we know that paracetamol which is available in a common dosage, that is 500 milligram. That is a common usage of one tablet of paracetamol. If you are taking the paracetamol 20 tablets, of 500 mg each or single dosage of 7.5 to 10 gram, it can be considered as a paracetamol toxicity. Okay, so it can cause severe adverse effects in the patient's body. So if the patient is consuming large amount of paracetamol tablet, there will be some features like abdominal pain will be there, irritability will be there, generalized weakness, loss of appetite, jaundice. Jaundice is mainly due to the disturbances with the liver function. We know that liver is an area or is an organ which detoxify many of the drug or many of the harmful products. If the liver is damaged with this type of toxicity, there will be some kind of jaundice or yellowish appearance of the skin can be happening. Then what is how we can manage with paracetamol toxicity? The option was NAC, that is N-acetylcysteine. Current FDA approved protocols for the management of paracetamol toxicity, we can manage either with oral or IV loading dose. It is up to the condition of the patient. If you are taking this IV loading dose, we should give 150 milligram per kilogram of NAC over 15 to 60 minutes, followed by the infusion of 50 milligram per kilogram over 4 hours, and the final infusions will be 100 mg per kg over 16 hours. So that is the dosage of NAC, that is 300 mg per kg will be the dosage. Then approximately 20 uh, approximately 20 hours or 15 minutes, that will be the approximate time period for managing with paracetamol poisoning. So this is some of the list of antidotes that is commonly it can be expected in other options. Suppose if the question was antidote of heparin, you can write the protamine sulfate as the answer. So our question is by antidote of acetaminophen, that is N-acetylcysteine. Otherwise, it is called as NAC. Then if the question was antidote of anticholinergics, the answer will be physostigmine. Then this is the commonly asking questions. Heparin. Antidote of heparin, that is protamine sulfate. Antidote of iron. Our option, second option was desferoxamine. If the question was antidote of iron, the answer will be desferoxamine. Then if the patient is having a high intake of morphine or naloxone, patient will be having high intake of opioids, naloxone will be the antidote. Then warfarin, antidote will be vitamin K. So this is commonly asking questions regarding the antidotes. So our question was antidote used in paracetamol toxicity, that is N-acetylcysteine. Atropine can be used in case of organophosphorus poisoning. So so that's all about the previous question paper discussion. So in this session, we have discussed regarding 5 questions and their options in detail. I hope you got an idea regarding these 5 questions and their options in detail. Thank you for watching.